Hi, this morning we're going to introduce the new coding system called PCS, ICD-10 PCS. Now, let me explain in a few words what it is. Now, we have done like 200 problems already with ICD-10 CM. And let me show you the book for ICD-10 CM, which is right here, right? Now, ICD-10 CM is for diagnoses, which means what's wrong with the patient. When a patient comes to the hospital, the doctor makes a diagnosis and tells him what's wrong with the patient, right? Now, this code that we're going to use is for procedures. ICD-10 PCS. PCS means Procedure Coding System. So once the doctor has told us what is wrong with the patient, or has found out what is wrong with the patient, we have to do something on the patient. We have to do a procedure to the patient in order to make him healthy again. So this is for procedures done. Now, what is the difference? We have studied a system for procedures already that's called the CPT, right? But now this one is the difference between the CPT and the PCS is the CPT is for doctors' offices mainly, and the PCS is for procedures done in a hospital for inpatients. Okay, now we're going to explain all this to you by just doing an example, okay? So the example that we have is the procedure is a cautery of nosebleed. Okay, when your nose is bleeding a lot, you go to the hospital and the doctor says, we need to do a cauterization. So that procedure is coded in PCS like this. 095 KXZZ. Okay, we're going to explain every single character, but let's first give you a little explanation of what it means. What's the procedure? Okay, I'm going to use little colors here. This is a vein in the nose, right? A vein or an artery. It means a tube where the blood flows, right? So this is the blood that is flowing. You see the blood is flowing? This is a regular vein or artery where the blood is flowing. Now, for some reason, the vein or artery here gets a hole in there, right? So, the blood, when it flows, it starts to flow, and then it comes out of the body, like that, right? And this is what causes the nosebleed, right? So, what is the procedure of cauterization or cautery of nosebleed? It's very simple. All you do is this is the damaged vein with a hole, right? And then what the doctor does is he puts an instrument in the nose and then he burns this part, which means he's destroying this part of the vein. It's no use now. He has sealed it here. So what happens now is that the blood, when it comes this way, right, it's flowing like this, finds that it's sealed, it only has to go back. It doesn't go out again, so there's no more nosebleed. That's the procedure, cautery of nosebleed. Now, in order for you to understand a little bit more how it's done, we're going to show you a little video on YouTube, right, for an actual procedure. I'm going to hold the camera while Stephanie handles the computer. Okay, let's go.
Nosebleeds are a common problem for which patients get seen by an ear, nose, and throat doctor. In this particular patient, she has been having recurrent nosebleeds several times a week for the past few months. The nose is carefully examined to find the source of the nosebleed. In some patients, there is a vascular knuckle that can erupt, causing a spurting type of nosebleed. In others, there are superficial blood vessels that can lead to an oozing or drippy type of nosebleed. Before cauterization, the nose is anesthetized using a cotton ball soaked with lidocaine. After a short period of time, cauterization can commence. The most common type of cauterization is using a silver nitrate stick. When applied to the nasal surface, nitric acid is formed that causes a chemical burn, turning the area brownish white. However, in certain situations when the blood vessel is large, a much deeper cauterization is required using electricity. Bipolar cauterization is shown here, whereby an electric current is passed between the metal prongs, burning the tissue not only at the surface, but underneath as well. It takes about 2 weeks for the area to completely heal.
Okay, that was the video. Now Stephanie's going to take the camera again, and then I'm going to explain what happened there. Okay, let's erase this part from the explanation. Now remember, the procedure that was done is a cautery of nosebleed, and this is the code, the PCS code, right? So we're going to analyze every single character, what it means. So we have this grid here. We're going to put the code here: 0, 9, 5, K, X, Z, Z. Okay? So every character means something. And what it means is on top of this. Okay? Now, the first character is the section, the general section of the code, right? Of the procedure. So in this case, the 0 represents the medical and surgical. So if you see a PCS code that starts with 0, all those codes that start with 0 are medical and surgery. So because this is a small surgery, right? So that's what is in this section. The second character is the body system, which means the group of organs where the operation is going, or the procedure is to be done, right? In this case, the body system is the
ear, nose, and sinus.
And that's 9, right? So we're going to write it down here. This is the ear, right? Nose and sinus. The third character is the root operation. What does the root operation means? What was the main procedure, right? And in our case, it's
this is destruction.
A destruction. We destroyed a vein because we seal it and we destroy it. So the 5 means destruction. Okay? Now, the next character, the fourth character, is the body part, right? In the K represents the
nose.
The nose. So this is the nose, because the procedure was done on the nose. The fifth character represents the approach. How was it done? And as you saw in the video, it was done as an externally. So the X means external, right?
Right.
Now the device is if we leave something after the operation, like it could be a pacemaker or it could be a graft or something if we leave in the body. Since we didn't leave anything, we put no here, and the Z is for no. And the qualifier is the last character, and this is just an extra character just in case you need it. In this case, we don't need it, so it's a no, to, or a Z. Okay? That's the meaning of each of the characters for the code. Now, how do you find it in the book? We're going to show you now with the actual book how it's found. Okay, I'm going to take the camera and Stephanie is going to show you in the computer. First, let's look at the path. Okay, it's a cautery of nosebleed, and there's one code, and the code 1 through the index is found like this.
First you go to index.
Go to index.
Then you go to cauterization.
Cauterization.
C, destruction.
Uh-huh.
Then you go to destruction.
Uh-huh.
Then you go to nose.
And?
And it gives you this code 095KXCZ.
Okay, that's the code that you get in the index. Now you're going to check that in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Mm-hmm.
Then you go to 095K.
Right.
That's the nose.
That's the nose.
Then you go to 095KX, external.
External.
Then you go to 095KXZ, no device.
Uh-huh.
Then you go to 095KXCZ, no qualifier.
And the equal sign means that that's our code, right?
Yes.
So now we're going to do the same thing by using the actual books, okay? So we're going to start with the index, right?
Right.
We're going to find colorization, right?
Yes.
Where's colorization?
Here.
Let me see. There you go, right?
Destruction.
Colorization, okay?
Yeah.
And it says C, destruction, right?
Yes.
So the other one is C, repair, but we're not repairing the vein, we're destroying it because, I mean, you're just sealing it off. It's not used anymore, that vein, so we're destroying it. So let's go to destruction. In the same index, we go to the D, right?
Right. And here we have
destruction.
nose.
This is the D for destruction, you see, and then we're going to go to nose. Where's nose? There it is.
Right
nose, right?
Right.
Right there, nose. And what is the code?
That is 095K.
Okay, those are the 4 initial characters, and now we're going to check this in the tabular, right?
Right.
So you go to the section of the tabular. And then this is in alphanumeric order, so what is 090, 095, right? And then
Here.
there it is, right?
Yes.
Can you read the whole thing? 095 is what?
095 is
0 is medical and surgical, right?
Yes.
From the top. And 9 is
ear, nose, sinus.
sinus. 5 is
destruction.
destruction. Okay. And now we keep adding one more character. The K is
Nose.
nose. Then one more character.
Approach is X external.
X external.
Then there's no device.
No
Z,
device. We didn't leave anything in the body.
Z. And the Z, no qualifier.
No qualifier. We don't need anything extra to describe this procedure, right?
Right.
So that's how you find it in the book. Now we're going to finish this video by just inviting you to visit our website right here, and then everything about PCS we're going to put it right here in the green section of our website. Okay? Thanks for watching, and please visit our website, which is right here. Thank you.